It's 2020, and my practice of urology has evolved dramatically over the last 5 years. There has been a renaissance in new technology that's out there. When I have a patient that comes in for prostate cancer, most of my patients come and see me, and they're here for a second or third opinion. They've already been diagnosed with prostate cancer, and they're here to learn about new options. And we offer the latest and greatest of things. If you're gonna have surgery, if you're gonna have a robotic prostatectomy, I'm gonna do intraoperative nerve monitoring and look at the nerves and actually see where they are so I can preserve them as I'm cutting out your prostate. If you get radiation, we're using Spaceoar, which is a hydrogel that separates the rectum from the prostate and spares the rectum from radiation. And we're also offering HIFU as an alternative to surgery and radiation to treat prostate cancer. It's just been exciting to see the boom in technology and the new things that we can offer men. When a patient comes in for prostate cancer and they've already been diagnosed with it, I want to make sure we haven't had an MRI and an MRI fusion biopsy so we can pinpoint where the cancer is. And I'm looking at, can we actually see the tumor on the MRI? And then how aggressive is the tumor? We look at Gleason score, but I also look at genomic testing. I love Prolaris, and Prolaris will really tell us how fast the cells are mutating, how fast the cell cycle progression is, and that can tell us how aggressive a cancer is. And once we look at the MRI, the Gleason score, the genomic score, the PSA, and really sit with the patient and look at all these things, so we can make a custom tailored plan for that patient and for their cancer. It's truly individualized medicine. And this is a game changer. Now, if we find a tumor that's in the prostate, it's often quite small. I have guys that have a prostate the size of a walnut, and their cancer is the size of a pea. Why would we take out the whole walnut? You know, it makes more sense to me if we could treat just where the cancer is. Right around the prostate, you have nerves that help with erections. And if you radiate the whole prostate, if you take the whole prostate out, those nerves are affected. And it takes a while to regain sexual function after a prostatectomy, and it is never the same as it was before. Urinary incontinence, that's there. People leak urine after prostatectomies. And they get it back. A lot of my patients are dry now, but they're wearing pads here and there with strenuous activity. They definitely have a change to their life that they experience with surgery. No doubt about it. With HIFU, I can treat just where that cancer is and leave everything alone. And the consequence is that they don't leak urine, and there's less erectile dysfunction as traditional treatments. And that is a game changer. With HIFU, the disadvantage with it is it may not work as well. There are recurrences. Sometimes prostate cancer can be multifocal. That means it can be in different parts of the prostate. And if I treat just one area, if you come in here and we just treat where the cancer is, you're going to need to be followed because there is a chance that cancer could come back in another part of your prostate. But with HIFU, it doesn't limit your options moving forward. You can go on and have surgery afterwards, and that's been shown to be safe. You can have radiation afterwards if the cancer comes back and it's super aggressive. You can have HIFU again if it comes back. The overall success rate in my series, depending on the patient, is anywhere from 80 to 90%. And if you look at the literature from Europe, they echo that this is a very effective procedure. Maybe not as good as surgery or radiation, but it's kind of a middle ground approach that's going to treat majority of men just fine, but preserve their sexual function and preserve their urination. And that's what I find that a majority of men are looking for in prostate cancer treatment selections. And at East Valley Urology Center, we are proud to offer that, and we've been offering this and become the leaders of HIFU in the state and in this part of the country. And we're excited to share our experiences with you and take you on your journey.